Knock, knock, knock. Hi, I'm Leola. I'm going to be your student nurse today. I'm just going to provide for privacy and perform hand hygiene. Could you give me your name and your date of birth? Perfect. And do you have any allergies?
Sulfate and betadine.
All right, and then I'm checking your wristband to make sure that's correct. Today, looking at the provider's orders, it looks like we're going to be giving some IV fluids, but we do need to start an IV first. Is that okay with you?
Yep.
All right, perfect. I have all my stuff, and I have you in a are you in a comfortable position?
Yep.
I got my linen underneath the arm. And I'm just going to make sure that none of my stuff is expired, and I have all the correct supplies. So I have, this is not expired. Alcohol, got my IV start kit, which is not expired. Got my regular saline and my 20 gauge needle, which is appropriate for this patient, and my gloves. So now I'm just going to start by opening up my supplies. So I am going to start with my J-loop. Without touching the sterile end of the J-loop, I'm going to flush it with some saline. I'm going to loosen up the cap a little bit just so I know that it is flushing. Alright, that's prepared. Now I'm going to open up my IV start kit. There we go. Alright, I'm just gonna get this tape out. I'm gonna get this tape already out so I don't have to worry about it later with gloves on. I'm just gonna put it to the end of the table so I have it there. I have my Tegaderm dressing that I would peel off. Then I have my tourniquets. Then I have my needle over here. So first I'm just gonna start by putting on a tourniquet. 4 to 8 inches above the site. It's gonna be a little tight. And then I'm just going to feel for vein to see where the best vein will be. I think I'm gonna try going right there. So now that I have where I want to do my IV, I am gonna give my patient a break from the tourniquet, and I'm gonna put on gloves. And I already did hand hygiene. So now I'm just going to clean my patient off. They did not have any allergies to this alcohol swab, so we're good there. Well, this one has iodine on it. But I would clean off the surface. And with using an iodine one, you would clean off the gauze with the iodine with the sterile gauze dressing after letting it dry. Now I'd clean it for 30 seconds. Now that I have done that, I am going to replace on the tourniquet. And I'm going to make sure not to touch where I cleaned it. I'm going to open up my catheter, my needle, and I already know that it is the correct size for my patient. I'm going to take the cap off. I'm going to make sure it's bevel up. And I'm just going to pull back on that skin. And you're gonna feel a little poke, 1, 2, 3. Once I got it in there, I'm just gonna level it down to the skin, and I'm gonna advance it the rest of the way in. And once I see blood return, I will click it, push it in. I'm gonna take off the tourniquet, hold down the catheter. I'm gonna insert J-lube. Holding it down, I'm gonna flush in 3 to 10 milliliters of normal saline. And since I did not get the blood flashback, I would redirect it and I wouldn't take the needle back out and put it in again. I'm going to clamp it off. I'm going to take off the saline. I'm going to place down, I would take off the Tegaderm, the sticky part of the dressing, and put it down, making sure not to cover anything. I would put time, date, initials on it. And then I'm just going to position my patient's J-loop and I'm going to stick it on just so it's secure. All right. I would, like I said again, I would make sure that it was dated, time, initials, and date. Is there anything else I can do for you?
Nope.
All right, perfect. So I would make sure to throw my needles in the sharps container right away. I'd throw away the rest of my materials, do hand hygiene, and chart.